a cup of coffee a day may not be harmful for some adults with AFib and could actually lower episodes. That's according to a new study. I'm now joined by San Diego cardiothoracic surgeon, Dr. Alexandra Kharazi. Thank you so much for joining us. And I told you off camera before we dive into the study and the new research, what is AFib, if you can kind of give us the details for those who don't know and the impacts and maybe who it impacts the most.
Sure. Atrial fibrillation is one of the most common rhythm disorders, and the chances of getting AFib actually increases with age. So over age 40, 1 in 4 people are at risk and can actually get and manifest an episode of AFib at some point in their lives. And there's multiple risk factors for it. We already did mention age, but as well as genetic factors and family history of AFib, and different medications and certainly different heart conditions. As a heart surgeon, I see AFib in a lot of my post-op patients.
And I know that we're showing video of the coffee. What have the research findings, the latest ones, kind of uncovered about the relation between coffee and AFib?
So it's actually very reassuring. So conventional wisdom has always taught us doctors to advise our patients to stay away from coffee in patients that have rhythm abnormalities, particularly AFib, but that's not what this study showed. So this study looked at 200 people with a history of AFib who were shocked back into a normal heart rhythm. And after the cardioversion, they were randomized into 2 groups. And the first group was encouraged to drink 1 cup of coffee a day. That's important, 1 cup. And then the other group was encouraged to abstain completely from coffee. And it actually showed that the group of coffee drinkers did not have an increased rate of recurrence of the AFib and may even have had a slight benefit.
How surprising were these results for you guys who work with patients who typically are intimidated by the coffee intake and have to be aware of how much coffee, caffeine they're consuming?
Well, like with many things, the poison is in the dose, right? So this looked at 1 cup of coffee. And so can we extrapolate that to people who are drinking Red Bull and multiple Celsius and taking caffeine pills? No, I don't think that that's safe. So, but what I think we can say is for people who tolerate coffee well and who feel good with it, we now have reassuring findings that we don't have to discourage them from coffee drinking in the setting of this extremely common rhythm disorder, AFib.
And was there anything that kind of stuck out about this study in particular that made it so, I guess, noteworthy versus other studies you guys might have done in the past?
So there's been multiple studies that have shown maybe either a neutral effect or an increased benefit, but in this specific study, they did randomize it into these 2 groups, and it was probably the most robust study that was done looking at this effect. So again, it's not saying coffee is medicine, like we're not going to be using coffee to treat AFib by any means, but it is very encouraging to say that it's safe. We can say 1 cup of coffee is safe in most people. However, it's important to talk to the cardiologist as well and your doctor, because there could be other medications that you're on or other conditions you have that could be that can negatively influence how coffee is affecting your AFib, your specific case.
Because I was reading in the study that not every patient is going to be able to kind of up or add to their coffee intake. There are some who should be wary still, right? As you just mentioned.
Absolutely. Yes.
And as far as those who kind of don't know the warning signs of AFib, who may, again, get diagnosed early, what are some of the warning signs that you would tell folks who aren't familiar with it or may have it in their family history and should be wary of it?
Absolutely. So I think as incidence goes up with age, the first thing that I would say is to just check in with your primary doctor or cardiologist, and then they can check out your heart. And then secondly, the most subjective symptom I hear is palpitation. So people often feel their heart flutter in their chest, and that's how they describe it.
And is this something that they should get checked regularly if they do have a family history of it?
Everyone's different, but I think it's good to just check in, particularly as we get into our older years, because there's so many medical problems that could be affecting our hearts.
Okay. Well, thank you so much for joining us and giving us more details about the findings. Again, you can find more information at cbs8.com. We'll be back after this.